Hi, this is Jessica DaMassa with WTF Health. I'm here at Health 2.0 at HIMSS in Europe, and joining me right now I have Bettina Experton. She is the CEO and founder of Humetrix. So tell me a little bit about Humetrix. I understand that what's really cool about your solution is that you are one of the very first prescribable mobile applications, right?
That is correct, Jessica. So extraordinary happening, and I think a novel happening in digital health is that digital therapeutics, as we call them now, can be mobile application held by patients, for use by patients, e-prescribed by their physician. And starting in May, in England, 60% of GPs using the HIMSS Health electronic medical record can now, from their electronic medical record, e-prescribe 2 of our mobile application, SOS QR for emergency care and Tensio for hypertension coaching.
That's so cool. So tell me a little bit, I want to know about the hypertension coaching in particular. What does it help a patient do? I'll hang on to it.
So hypertension is a very prevalent disease. It affects about 1/3 of adults. And the therapy is not only to pop a pill. It takes a whole lifestyle modification, if you wish. And so a care plan for managing and treating hypertension include medications, but as well lifestyle modifications. So Tensio has a holistic approach to hypertension management. It's a coaching app. So when the GP in England or a physician in the US prescribes this app, then the patient go home with this app and can monitor their blood pressure at home, be notified and alerted what to do next, whether it's to exercise more than they had at that point of the day, lose more weight than they have according to their care plan, take their prescribed medication, of course, monitor their blood pressure and so forth.
Okay, so where are you guys based?
San Diego, California.
Very good. And I understand you've been around, one of the things that surprised me about Humetrix is that you've been around for a long time. So you said 20 years you've been in the industry.
I founded Humetrix in 1999, so it's about 20 years,
well,
yes.
Congratulations,
yes.
That's really cool. And so how did you make the transition from what you were doing into digital health? Tell me a little bit about that, because I don't get to talk to a lot of startup founders who have that kind of experience. So how did you do that?
So I'm a physician to start with, an internist trained in oncology, emergency medicine. But then I became a public health officer in California and got a degree in public health with a computer science background. So for me, putting all that experience together made sense. Yes. And putting actionable information and knowledge in the hands of patients has been a driver for me. And that's what Humetrix is about. It's putting in the hands of humans, intelligent software metrics.
So why is that so important to you? I love that you just said that. Why is it important for you to empower the patient with this information?
Because the patient knows best, in fact, what's wrong or what they need in terms of their healthcare. And their healthcare is complex as we get older. We are suffering from multiple chronic conditions, and we go from one physician to the next. And expecting that single physician at a particular time we visit will know all about our history is ludicrous. Yeah. So the logic and the common sense approach is put that history in the hand of the patient. That's a blue button movement and program. And by the way, Humetrix has the first mobile application approved by Medicare to put that blue button medical history coming from claims in the hands of 53 million Americans, which is extraordinary. So this is a common sense approach, Jessica, right? Is you need to bring that necessary information for your physician to render the right care. And if you have the tool to do that, that's what we are all about.
So that tool. Right, we are right now, I think, at a time where it's everybody's talking about getting the data free and belonging to the patient. Do you feel you've been in this industry for a long time. Do you feel like this is it? That we've hit a tipping point where the patient is going to really get access to all of their medical data?
I truly believe so. After 20 years, this is the time. I think it's a convergence of the right technology, which is that mobile phone, which is in everybody's hands. So you can do this computing on the edge. You don't have to invest in the infrastructure touching that patient because they already have that mobile device. Right. Now you have open data policy everywhere around the world because it makes sense from government payer perspective to provide access to that information with that medical history again, so that the claim information for Medicare or in the NHS, providing that information in the hands of NHS patients makes sense as well. well. So open data policies, of course, is escalating costs which affect patients to start with, because they pay out of pocket more and more, and they're more motivated to have that knowledge and information and the tool to communicate better and inform their physician wherever they go of what has been their experience with the treatments they were prescribed to, what is the knowledge base they can provide their physician, and the whole system needs absolutely patient participation.
Beautifully said. Thank you so much for joining us. It's a pleasure to speak with you, Bettina. Very good luck with what is next for Humetrix. It's exciting to see what the next 20 years will bring. Thank you so much. This is Jessica DaMassa with WTF Health.